everyone, thanks for tuning into Veronica and Shannon Know Everything. We took a little hiatus from our fans. We just didn't really understand Hemononc well enough to even make videos. But we're back with another subject that we don't also really understand. There's some med students sitting over there who are really loud, so thanks for tuning in. Nephrology. It doesn't really make any sense, but we decided we'll just try to memorize it and pass our classes. So hopefully we'll help us in a year, future Shannon and Veronica pass the pants. So to start with, our glomerulus is just the specific structure. It's the glomerular capillaries. So we call the glomerulus and glomerular capillaries synonymous. So within the kidneys, different parts of the kidneys can have different problems. So you can have glomerular problems, which is a problem with the capillaries, or tubulointerstitial. For this video, we're going to be talking about glomerular problems. Specifically, you can divide glomerular problems into two different types, nephrotic and nephritic. This is very confusing for some people because nephritic used to be called acute glomerular nephritis, but now it's kind of changed to nephrotic and nephritic syndrome. I should have written that. So just remember, if you're looking this up in material, if you see glomerular nephritis, that is a glomerular problem, specifically nephritic syndrome is what we're trying to call it now because it's more of a syndrome. So I'm going to go over nephrotic syndrome, and then Veronica's going to do nephritic syndrome. The main differentiation between nephrotic and nephritic is whether you're pissing proteins or red blood cells. So nephrotic, proteinuria, you can remember OO, and then nephritic, hematuria, red blood cells. So I drew here, we have our second, as I like to say, glomerulus, and it's kind of letting proteins go through, which we don't normally have in our urine, and then we're peeing out the proteins. So the three main clinical manifestations are proteinuria, hypoalbuminemia, and edema. Really, you only need to know the proteinuria because then it's intuitive to think, okay, if we're losing all the protein into our urine, we're going to have low protein in our blood. So proteinuria, but then hypoalbumin, a type of proteinemia, so low protein in the blood. That also leads into the edema because when you have low protein in your blood, you have low oncotic pressure to pull fluid back into your capillaries. So you end up leaking a lot of fluid, which leads to edema. So if you know proteinuria, it's intuitive to deduce hypoalbuminemia as well as edema. So moving on to the types, there's primary and secondary. We're just going to go through primary because secondary is not too bad. So for primary, we have minimal change disease. No, don't watch.
Come on, I gotta learn too, man.
No. Minimal change disease, focal segmental, and membranous. We have a dirty mnemonic to remember this. It takes minimal focus to have a membranous orgasm. So orgasm is O and nephrotic O. So the minimal is minimal change disease, focus is focal segmental, and then membranous is membranous glomerular nephritis. So important amongst these three is to differentiate what is kids and what's adults. So minimal change disease, the only thing to know about there's a lot to know about this, but the only thing we know is that it affects the podocytes in the epithelium, and then this happens in kids, whereas focal segmental, kids and adults, and then membranous adults. So moving on to complications of nephrotic syndrome, the main complication, and this will definitely come up, is clots. There's something with the proteinuria that you also have hypercoagulability of your blood, so you have a lot of clots, and then you also have an increased risk of infection. I don't really know, I just think because the proteinuria, maybe the patients are more sick, kind of less quality of life, so they're getting infections, and then high cholesterol. We also don't know why for this one, but if you think kind of diabetes happens, that's a secondary nephrotic, you can remember, okay, there's also high cholesterol, more infections maybe, and then the clots, so we think, oh. Treatment for nephrotic syndrome, a lot is just treating the underlying cause. So for this one, sometimes you have to do a renal biopsy for investigation if you think it's a primary problem. But if it's secondary, it's just like diabetes, then really you're just going to try to control the blood pressure, control the fluid with diuretics if you have the edema, and then definitely do an ACE inhibitor. And the only thing is that some of these need steroids, so for minimal change disease in particular, this one is a pretty quick fix, prednisone for the kids, and then they should be better. So I'm going to switch over to nephritic syndrome, In conclusion, that was nephrotic syndrome, which is proteinuria, hypoalbuminemia, edema. We have 3 types: minimal change, focal segmental membranous, and the complications are clots, infections, and hypercholesterolemia.
Hi guys, welcome back to our channel, as Shannon already mentioned. So just to go over quickly, she went over nephrotic, which was the protein, and now we're moving over to nephritic, so the I, which is red blood cells. And so this is an inflammatory process that's occurring. And so what you're going to find is that, again, you have the inflammation within the glomerulus, and now you have red blood cells that are coming through. And so a few things that are associated to this, the main ones are going to be the ones with the stars. So oliguria, which means that you're having small amounts of urine. Scanty. Hematuria, which means that you're having those red blood cells within the urine. Again, going back to nephritic, which means red blood cells. You're going to have a little proteinuria, not too much. You're going to find hypertension is associated with this as well. Azotemia, and then hyperkalemia as well, which is due to hypoaldosteronism. So a way to remember the primary causes of this is going to be, I'm a pro at eating infected burgers. So pro goes with membranoproliferative disease, infected, post-infected glomerulonephritis, and then burgers, which is the IgA nephropathy. So again, I'm a pro at eating infected burgers. So complications that can occur with nephritic syndrome is hyperkalemia, so increased potassium, and pulmonary edema as well. So as far as the treatment for this, you really want to treat the hypertension, and then you want to decrease intake of potassium as much as possible, and you want to avoid ACE medications with these patients. So quickly the basics: nephrotic, nephritic. Nephrotic is protein, nephritic is red blood cells. The best way to remember the underlying causes, the primary ones, is with these great mnemonics. So it takes minimal focus to have a membranous orgasm, and then I'm a pro at eating infected burgers. And that's all for today. Thanks for tuning in, and we'll catch you guys next time.